1 million Virginians have no health insurance. Increasingly, they are our neighbors, friends, and family. A single, unforeseeable moment can devastate a life, perhaps even yours. The Virginia Healthcare Foundation stands in the gap, making primary health care more available to uninsured and medically underserved Virginians, people who would otherwise suffer untreated. The Virginia Healthcare Foundation, standing behind community programs that touch thousands of lives across the Commonwealth. Welcome to Health Cares with your host, Deborah Oswalt, Executive Director of the Virginia Healthcare Foundation.
Has your child ever awakened crying in the middle of the night, suffering from a sudden illness or a high fever? I remember those nights, worrying what was wrong, and the relief I felt when I took him to the doctor the next morning. My health insurance covered those costs. Unfortunately, more than 185,000 children right here in Virginia are uninsured. Their parents are often forced to defer doctor visits and rely on over-the-counter medicines. The end result can be a trip to the emergency room for a far more serious condition. The good news is that the majority of these children qualify for health insurance through a state program called FAMOUS. That's the focus of this edition of Health Cares. Hello, I'm Deborah Oswalt. With me today are Marilyn Tavenner, Virginia's Secretary of Health and Human Resources, and Pat Finnerty, Director of Virginia's Department of Medical Assistance Services. Together, they are responsible for Virginia's FAMOUS insurance programs. Welcome. We're delighted that you are both able to join us today. So Pat, let's start with you. What is FAMOUS? What does it stand for anyway?
FAMOUS stands for Family Access to Medical Insurance Security, and it's Virginia's health insurance program for uninsured children.
How long has Virginia had the FAMOUS program?
We've had the program since 1998.
So about 10 years, actually.
It is.
What does this health insurance called FAMOUS cover?
It covers a wide range of benefits. It covers inpatient and outpatient hospitalization, physician office visits, prescription drugs, dental coverage, vision coverage, and also x-rays, tests, and laboratory.
Who is eligible to participate in FAMOUS?
It's eligible for children in Virginia. You have to be a Virginia resident, uninsured, under the age of 19, and the family's income has to be below 200% of the federal poverty level. And that amount varies by family size. The larger the family, the larger amount of income that a family can have and the child still be eligible. For example, a family with just two persons, you can have income up to $28,000 on an annual basis. For a family of four, it's around $42,400. The program really is targeted for families whose income is too much or is too high for the Medicaid program, but not enough to pay for private coverage on the commercial market.
Very much working families.
Absolutely.
Marilyn, why does Virginia have FAMOUS? And why is health insurance so important for children?
Well, I think the state realizes how important it is to start children off in life with healthy, prepared for school. Frequently, there's a lot of preventive care that goes on with small children, immunizations, dental care, vision care. These are the types of things that helps a child prepare for school.
Are there instances from your previous lives as a nurse and a hospital administrator that underscore the importance of health insurance for children?
Absolutely. I think many times families think their children will be healthy, they won't have issues, so they may not be as concerned about insurance. But then there can be a car accident or a biking accident, skateboard, so we frequently see these children in the emergency department. They may need surgery, a couple of days in the hospital, so this is a way of helping them make sure that they're cared for and that the families are handled with an insurance plan that works.
You know, we have something like 123,000 children, if I'm remembering correctly, who are eligible for this program, but who haven't signed up yet. What are we doing what's the state doing to try to reach out to them?
It's a very good question. Many times people may need this program on a temporary basis, but they don't know it's out there. So we try to work with health departments. We try to work with schools each fall when school enrollment begins. We talk about this program. We do radio ads. We do television ads. We try to work with physicians' offices to make them aware.
I think we have one of those commercials with us. Let's watch it.
Being a single mom is tough. Being a single mom with no health insurance for your children feels almost impossible. I know, I've been there. Not being able to cover my children if they got sick or hurt is a terrible feeling for a mom. I work really hard and want the best for my children, but I just couldn't afford health insurance. It's expensive. I didn't have the extra money. I knew there were government programs out there, but I didn't want them in my personal business. I needed help. I knew that. But some of those programs are so complicated. And when your child is on those programs, they don't get treated as well as children with regular insurance. You know, a different doctor every time. That's what I thought, but I was wrong. Even though I still couldn't afford it, I got my children the health insurance they needed. The best doctors, the best hospitals, the best insurance, just like everybody else had. Now I can keep my kids healthy. It's because of Famous. And none of those fears I had happened, not one. Famous helped me get there. They helped sign me up. They showed me exactly how to renew every year, and it was so easy. It was really easy. With Famous, you can get your children the health care they need now. If I could do it, anyone can do it. Famous works.
Sign up today. It's easier than ever before. Call 1-866-87-FAMIS or go to www.famous.org.
What a wonderful commercial. I'm sure that's going to have a tremendous impact. Let's talk about teeth. Pat, does Famous have dental coverage?
Sure. Dental coverage is a very critical part of the benefits that Famous offers, and it's a very comprehensive benefit. And it includes preventive care like cleaning, sealants, x-rays, that type of thing. Also restorative care for any kind of cavities that a child may have, extractions if necessary. But it also includes orthodontia services if medically necessary. It's not for cosmetic purposes, but medically necessary orthodontia is covered as well.
And are there dentists around the state who are participating in this program?
Absolutely. In fact, we've increased that number by quite a few over the last couple of years. We now have about 1,100 dentists across the state, and the network is still growing. But the program is developed along with the Virginia Dental Association and the Old Dominion Dental Society. And so we've been very pleased with the progress we've made in making these dentists available to the children we cover.
How can interested families apply?
It's very easy to apply, and there's a lot of different ways to do it. A family can apply online at our website at www.famous.org. You can complete the application right online, or you can download it, fill it out, and either mail it in or fax it in. You can call our toll-free line at 1-866-87-FAMOUS and complete most of the application over the telephone, or you can go to a local Department of Social Services. And also we have a number of community outreach partners that the Virginia Healthcare Foundation helps make available, and they can get application assistance there as well.
I want to thank you both for being here.
Thanks for having me.
And for all you do to try to cover the children of Virginia.
Has the cost of health insurance at your job increased? Recently released data shows that Virginia ranks first in the nation for the amount employees must pay for health insurance at their jobs. They shouldered an average of 24% of the premium cost in 2006. This was an increase of over 20% from the previous year. No wonder the number of uninsured Virginians keeps increasing.
We've learned about the Famous programs from the state's perspective. Now we welcome Dr. Bill Moskowitz, Interim Chairman of the Department of Pediatrics at Virginia Commonwealth University.